You are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Ogban. Today's section, we are still in the region of the thorax, and today one important thing which I want to make it as easy as possible so that every student, will be able to understand this without any difficulty. And it is something we call the coronary circulation. Okay, now one thing that whenever we talk about coronary circulation, it comes into our mind is that yes, the heart, okay, central circulation of blood is taking place in there, okay, is pumping blood to various parts of the body. Then how about the wall of the heart itself? They also need some kind of nourishment coming from this, oxygen-rich blood. And that is why, importantly, the heart will be equipped with something we call coronary arteries. Yes, after we made use of this oxygen-rich blood, yes, it got to come to the right atrium of the heart once again, okay, for subsequent oxygenation after going through what we call the right ventricle, okay, pumping it to what we call the pulmonary trunk, getting to the lungs eventually for oxygenation. So it means that there should be a way, by way of venous drainage, okay, coming, okay, drain that kind of oxygen poor blood from the wall of the heart. And that is why we will not only have the coronary arteries, we will also have what we call the coronary sinus. Because importantly, we will learn about the veins which will be draining the wall of the heart eventually. Most of them, okay, except something I will tell you, will be draining into what we call the coronary sinus. So my friends, without wasting my time, let's set the ball rolling, looking at the coronary circulation of the heart. And so to begin with that, we begin with the coronary arteries. That's the first thing we want to look at, the coronary arteries. So wherever you are, you do it exactly as we are doing it over here. Okay, stepwise. Coronary arteries. Okay. Now the first thing that I want you to know is that there are two coronary arteries. Yes. There are two coronary arteries. One other thing to which I can be a question for you is that what are the first branches of the aorta? And I believe that you tell me the answer is the left and right coronary arteries. They are the first branches of this, aorta. Most people, forget about that one and they look at that of the arch of aorta having the BSC branches, the brachiocephalic trunk, the left, common carotid artery, the left subclavian artery. No, the first portion of the branches coming from the aorta is actually coming from the ascending aorta, and that is the coronary arteries. Now, to make this one easy for us, then we want to actually draw, okay, something about this heart. You know that as I always do it, the heart will be like a shoe. Okay, let's draw something which resembles the shoe. Okay, so if I have this to be my shoe, okay, then of course my problem is half solved. Okay, now the first thing that I want you to know is that, let's say over here I am having the aorta over here. Let's think that the aorta is over here. Okay, now if the aorta is over here, then what is going to happen is that I'm going to have these cuffs. Remember that the aortic valve, just like the pulmonary valve, okay, just like the right atrioventricular valve, yes, they are all tricuspid. So you can see all these cuffs that I have over here. Now, if I nomenclate them, okay, with some variables, okay, let me see some letters of the English alphabet. Let me call this one A, then I call this one B, and then this one C, okay, in this manner, okay, anti-clockwise. Now the A I have over here, okay, with respect to what we call the orientation. Now this is the superior point. As I come this way, I'm going inferior. Now take it that as I go this way, I'm going posterior, but as I come toward the A, I'm coming to the anterior portion. Now the A over here, we will call it the, okay, that is something we will call the right aortic valve. Okay, the A over here, what we find over here, we call the right aortic, valve. And then, of course, the one over here, which is, of course, the B over here, you will call it, okay, if this is toward the right, then we can see this is toward the left, okay? So this one becomes the left aortic valve. Okay, now let's go through this one bit by bit so that you understand the concept I'm trying to convey over here. And then the C. Yes, the C is more or less like, okay, in real time, it's a bit posterior. Okay, it's a bit posterior. So we will call this one posterior valve, okay, of the aorta. Now, don't forget that from what we call the truncus arteriosus, okay, with the help of something called the spiral septum or the aortico-pulmonary septum, yes, from the embryology, I've done these videos, you get to know that you have not only the ascending aorta, but also a bit in front, we are going to have what we call the pulmonary trunk. And this pulmonary trunk will also be having the left, okay, and right, okay, valves. I mean, as in the cups. That's what I'm actually talking about. I'm talking about, the cups. Let me put it well. Okay, of the valve. Okay, I'm talking about the cups. Okay, so the same thing for that of the pulmonary trunk. The only thing is that because the pulmonary trunk is a bit in front, okay, compared to that of the ascending aorta, what we are going to see is that we are not going to have the posterior cups, rather we have the anterior cups. So that's how we are nomenclating them, clinical. That's what we see. But anatomically, what we see is that even this right aortic cups that we find over here, yes, you can see it's in front. And that is why this one will also be called, okay, let me use another marker to show it. This one may also be called the, anterior aortic, okay, cups. And my friends, this anterior aortic cups, okay, just above it, okay, it will have a space above it, and that space will be called anterior aortic sinus. Okay, so look at it, the name is anterior aortic sinus. The space where it's captured above this cups will be called anterior aortic sinus. Now, if I move away from that and I go to the B, which is my left aortic cups, what will happen is that if this is anterior, then you can see that these two are in the posterior region. And that is why this left, okay, aortic cups will be also called, okay, left posterior, okay, cups. And this one, yes, the space which will be captured above will be the sinus, of course, the left posterior aortic sinus. So please pay attention to these things. And then when I go even to the other side, where is the C? Yes, that's the posterior, but also posterior, but towards the right side. Now remember that things which are related to this area is towards the right. I told you that the right border of the heart is a vertical border, and then the left border is oblique. Okay, so whenever I draw this shoe, then you can, get that orientation right. Of course, we know that the vein which will be draining into the right atrium of the heart will be, of course, the superior vena cava. That of inferior vena cava will be coming from below. Okay, so this one is toward the right. So this C can also be called the right. This time is the right posterior. Yeah, the cups over there. And my friends, this cups captured above, then it will be the corresponding sinus. So once you've got this nomenclature right, then it means that, okay, life becomes easier for us to appreciate this. Now remember something. From this right aortic, okay, sinus, or this anterior aortic sinus we are talking about, okay, above it, okay, the sinus over there, that is where the artery, okay, is supposed to come out from. And which artery are we talking about? My friends, we are talking about, continue with this. This artery we are talking about is nothing but, of course, the right, okay, coronary artery. The right coronary artery will be emerging, okay, from the anterior aortic sinus. Okay, so that's the first thing. Now I want you to get the orientation right so that it becomes very easy for you when you have a real time, heart before you and you are supposed to identify these vessels. Now in the case of the left, posterior aortic sinus, this one over here, emerging from this region, of course, will be nothing but this time. Just let me call it a small trunk which will be coming out. I'll continue with it. This one is going to be our left coronary artery. Now the question is, where are these arteries after emerging from the aortic sinuses, the corresponding aortic sinuses? Where are they coming out from? Or where are they going to run? In what groove are we talking about? In what circles, are we talking about? So my friends, they will be running through what we call the, aortic, we have the ventricle and then we have the atria. So the atrioventricular what? Grooves. That's what we are talking about. And these atrioventricular grooves, because they are allowing these coronary arteries to run through them, that is why such groups will also be called coronary, sulci or coronary grooves. Yes, that's what we are talking about. They will be running through these areas. Now, my friends, in the case of the sinus, where it's captured at point C, which I call it the right posterior, aortic sinus, my friends, this one we don't have. Now, remember I told you that I have only 2 coronary arteries. So this one doesn't allow any coronary artery to pass through this area, and that is why this one may also be called the non-coronary. The sinus where is captured over there will be called non-coronary. Aortic sinus. So please having this in mind, then it means that we can really look at these branches, coming out of this, aorta. All right, good. Now, from the right coronary, now remember, if I'm comparing the right and then the left coronary arteries, as you see over here, what happens is that the case of the right coronary artery is longer. As in the trunk of the right coronary artery is longer, compared to that of the left. However, in the case of the left, it is a bit thicker, compared to that, of the right. It's a bit thicker but shorter in this manner. Now let's see something. The right coronary artery, yes, it will come downwards, running through a groove, which we mentioned it. That is at the level of the right atrioventricular groove or the right coronary groove or sulcus over there. It will be running over there, coming downwards. It comes downwards. Now, what is this? Now, last week I explained to you that this is what we call the inferior border of the heart. Now, it gets to the inferior border of the heart and then turns backwards. So it is going backwards. So let's pay attention. It will be going backwards in this manner. Let's say up to this point. It goes backwards in this manner. So this one I have here is my right coronary artery. Let me simply call it RC, the main trunk of right coronary artery, RC. We are saying that it comes downwards, it runs in the posterior aspect also. That's why I've used the dotted line. So it's going posterior. We are looking at it from the front view. So it runs through the posterior aspect. Now when it gets to the posterior aspect, it gives off a branch. And that is an important branch which I want you to know about it. It gives off a branch which goes downwards in this manner. Let me say up to here. It may even move. Let me put it over here. So this one is what we call the posterior interventricular artery. Now remember, we have what we call the right ventricle, we have the left ventricle over here. I've told that there's the right side and there's the left, the left oblique border. Now we have the right ventricle over here, we have the left ventricle. So the groove or sulcus behind over there will be the posterior interventricular groove or interventricular sulcus. So what I have over here is nothing but it is the posterior interventricular artery. Posterior interventricular artery. Now, invariably, almost always, in about 80% of the population, what we find is that this posterior interventricular artery is a branch coming from, of course, this right coronary artery. And this artery is very important because it is the one which helps us to know the cardiac dominance, okay, the dominance of the heart. So for instance, because this posterior interventricular artery is coming from the right coronary artery, okay, then it means that this heart becomes a right dominant heart. Okay, I'll come to another thing. Now, sometimes it may be coming from something else, and I'll explain it to you, which in such a case, okay, to be coming from something we call circumflex, artery, which will be coming from what we call the left coronary artery. In such a case, then it becomes a left dominant heart. Or sometimes both of them, by way of this right coronary artery and the circular artery, will give off this posterior interventricular artery. In such a case, we have a co-dominant heart. I will explain this as we move along. Now, one more thing that happens is that over here, this right coronary artery, I've mentioned some branch, okay, at the posterior, interventricular sulcus over here. But the important thing, the first branch, yes, I want you to know about this one. So, for instance, it's very examinable, can be asked that what is the first branch of the right coronary artery? The first branch of this right coronary artery actually goes on and supplies, okay, something that we did last week, the conus portion, the infundibular portion of the right ventricle, okay. So for instance, so that one will first come out, okay, the first branch which will come out going to supply, so let me say it's coming out from here, going to supply what we call the infundibular. Okay, now whenever I say infundibular, last week I told you that is the smooth outflowing portion of the right ventricle. So this artery over here becomes the first branch of this right coronary artery, and for this reason, my friends, we call this guy the right conus artery. Conus, okay, conus artery. And the conus for the right ventricle, we are talking about the infundibular region. For the left ventricle, we're talking about aortic vesicle. We explained this one last week. So the right conus artery. Now this is where there's another issue also here. Now sometimes because this right conus artery is the first branch coming from this right coronary artery, sometimes it arises directly from this aortic sinus. Okay, so now something that is often embraced is anatomical variation. So that's the normal situation, that this right conus artery is a branch of the right coronary artery, the first branch. However, because it's the first branch, it can even arise independent of this right coronary artery, directly from the aortic sinus. So for this reason, how many coronary arteries are we seeing? We are seeing 3. Therefore, this one becomes the third coronary artery in such a situation. So I want you to know that if in case it doesn't arise directly from the right coronary artery, but directly from the aortic sinus, independent of the right coronary artery, then it becomes what we call the third coronary artery. Third coronary artery. So if you are asked in exam that which of these arteries could be the third coronary artery, because it's arising directly from, of course, this time around we are talking about the right, okay, coronary sinus, or the anterior, coronary sinus, aortic sinus actually. That's what we are talking about over here. Now, apart from that, I read and know the right coronary artery also gives off a branch. Now, last week I told you something. In the supralateral wall of the right ventricle. Supralateral wall of the right ventricle, where in the uppermost portion where we have the crista terminalis, I told you something about that region. Now that is where we have the pacemaker cells of the heart. That is where the heart of heart is. And we're talking about who? The sinoatrial node. Sinoatrial node. That is where it's located. So let me say I put it over here, the sinoatrial node over here. The sinoatrial node, okay, will also be receiving blood supply. Now that one will also be coming from this right coronary artery. So let's say this. It will be supplying this, sinoatrial node. And that is why this artery will be called the SA nodal artery or sinoatrial nodal artery. Sinoatrial nodal artery. Now, if I mention sinoatrial nodal artery, then the next one, which is part of the conduction system of the heart, will be, of course, the AV nodal, atrioventricular nodal artery. And you know that the atrioventricular nodal artery, let's say it is somewhere here. Let me put it over here. Okay, assuming it's over here, then what will happen is that the artery where is going to supply it, my friends, will be coming from nothing, but it will be coming from this posterior interventricular artery. To be coming from this posterior interventricular artery. So this one is for the AV nodal artery. This is the AV nodal artery. Now, there was one time someone asked me a question. I was in a gross, anatomy laboratory. Someone asked a question that, we say the heart, okay, is myogenic. Now, the walls of the heart, the cardiac muscles, they beat on their own, they relax on their own without external nervous stimulation. Why are they able to do that? Of course, we know that the pacemaker cells over there, they are there, okay, conducting it throughout, getting to the bundle of his, getting the the left and right bundles, eventually getting the Purkinje fiber, supplying the walls of the ventricles and all that. Okay, then the question is, for instance, if I take someone's heart, okay, let's say it's an animal, I bring the heart out, you see that the heart will still be beating for some time and later, okay, it stops. Then why? Why do we see this phenomenon? The reason is simple. The reason is that, yes, once you bring it out, already the SA nodal, okay, all these ones will be getting some altered blood. So once it comes out, because the heart is myogenic, it doesn't require any external whatever to stimulate it, it continues to beat. But its beating will come to an end when the blood supply to it, okay, the oxygen-rich blood, yes, goes down, okay, and it's not receiving any because it has come out of the living system. Okay, that's one thing I want you to know. So this SA nodal artery is very important. If you don't have it, then of course your heart will also cease to function. Now, the other thing too that I want you to know is that this right coronary artery, now get your orientation right. Get your orientation right. This right coronary artery, along what we call the inferior border of the heart, along the inferior border of the heart, it also gives off a branch. Now I told you that it runs in the posterior aspect of this, what do you call it? The atrioventricular groove or the coronary, surface behind. But before it even goes there, it gives off a branch which runs along what we call the inferior border of the heart. Now I want you to know about that one. So it gives off a branch. So for instance, there's a branch over here which is giving off like this. Okay, so this is also a branch which is giving off. It runs along the inferior border of the heart. And my friends, interestingly, yes, we call this artery because it's running along what we call the border over here. What we call it is that we call it marginal artery. Marginal artery. Now, this is not the only marginal artery we have. We have another marginal artery which runs along the left oblique border of the heart. So for this reason, because this is coming from the right side, then we want to call this one the right marginal artery. Right marginal artery. Now, this right marginal artery, because of the angle that it makes with the main trunk, okay, of this right coronary artery, because of the angle. Now, this angle, in most cases, that's what we see, it is an acute angle. It's actually less than 90 degrees. Although from this one, you might think it's a bit more than that. But normally, we expect that the main trunk, okay, have the angle that it makes with, of course, this marginal artery, is an acute angle, less than 90 degrees. For this reason, we also call this artery acute marginal artery. So whenever you have the heart, you hold it, it's in your hand like a shoe. If you are looking at the right, side of the heart, we've seen that the right coronary artery will be coming downwards. It goes behind. It gives off this branch, posterior interventricular artery, and then you see that along what we call the right border, the inferior border, running down over there, you see this artery, and that artery is the right marginal artery, or what we call the acute marginal artery. I want you to know about that one. No, so are we done? Yes. So as far as the right, coronary artery is concerned, these are the main branches which I want you to know, which are extremely examinable points which you should become aware of. Now, having seen this, then the next thing that we want to appreciate is that of what we call the left coronary artery. Remember, as I told you, the trunk of the left coronary artery is so short. So immediately it begins to give off its branches. And one of the branches that this left one is going to give, will be this one, which runs behind. So it runs behind it this way. And then comes down in this manner. So it gives off this branch. Then it goes behind. So I'm running it behind. That's why I'm using the dotted lines. And it comes, and as if it is anastomosis with that of the right coronary artery. No. This anastomosis, structurally we can see there's some kind of anastomosis taking place. But my friends, branches of coronary arteries, they are functional end arteries. In other words, if this artery is having a problem, if there's a blockage in here, then this one cannot give blood. There will not be any collateral blood supply to this one, no. And that is why coronary arteries, taking care of your heart is extremely important. Now, my friends, this guy, because it's arching around, so it is like moving around it in a certain manner. So we call it circumflex artery. So, my friends, this artery we find over here is nothing but the circumflex artery. Now, some people write left circumflex and all that. Yes, it's not necessary, because at the end of the day, we don't have that of the right. So simply circumflex artery. Now, this is where I bring in the cardiac dominance again. Now, please pay attention. The cardiac dominance thing. I told you that for most cases, this posterior interventricular artery is contributed by this right coronary artery. But sometimes this posterior, because this one also runs in the posterior, intraventricular group, what happens is that it can also give off the branch. Now, under what condition? That is in situations where this posterior interventricular, right coronary artery doesn't get to this extent. Maybe it gets here and it ends. Let me just put something over here. Assuming it gets here and it ends. And then in the case of the circumflex artery, will run all the way downwards to this point. I hope you follow what I'm doing. It runs all the way to this point. When that happens, it means that this posterior interventricular artery will be a branch of this circumflex artery. But sometimes too, if they come to almost the same extent, then both of them will contribute to the formation of this posterior interventricular artery. Good. Now, having seen this, then what else are we going to see? We will also see, a lot of ventricular branches will be coming out of it. We'll give off a lot of branches. But one other branch, which is extremely important, which will also be coming from this left coronary artery, is nothing but this guy, which we find over here. It gives off ventricular branches, but the largest ventricular branch which it gives off is this one. Let me even go even more. This artery, just like we saw we saw posterior interventricular artery. This artery is running, okay, in the anterior interventricular sulcus. For this reason, this artery will be called anterior interventricular artery. Now, commonly we call it a name, okay, clinicians prefer to use that one, and that is something we call LAD, left anterior descending artery. Left anterior, and it is descending downwards, so we call it left anterior descending artery. Now you might see that structurally it's like anastomosis without the posterior, interventricular artery. Now these arteries are very important. If, for instance, this anterior interventricular artery, there's a block in it, okay, then ejection fraction, okay, the ability of the left ventricle, okay, supply most part of the left ventricle, yes, also that of the right ventricle is receiving some supply from it, okay, will be impaired. Okay, so you should understand some of these things. If someone's ejection fraction is going down, less than 40%, coming down gradually, mainly the main thing which is implicated is this left anterior descending artery, the LAD. Now, the other thing is that there will be other branches, okay, other ventricular branches and all that. But one of the branches which it comes out, okay, of this anterior interventricular artery, I want you to know that it comes out from this anterior interventricular artery are these branches. Let me use just one over here to show it. Now look at how I oriented it. I didn't bring it, now this is toward the left side, this is toward the right side. I didn't bring it, it didn't come this way, it came to the left side, okay, of this anterior interventricular artery, which means that this artery solely supplies the left ventricle. Yes, the right ventricle doesn't come in here. This branch is something we call diagonal artery. We call it diagonal artery. Yes, you may have more than one diagonal artery coming out, okay, of what we call the left side of this anterior interventricular artery. Something we also calling it the left anterior descending artery. The diagonal artery is becoming this way. Now, are we done? No, we are not done. There is one more thing which you should become aware. Just like we saw the marginal artery for the left side, we also have marginal artery, okay? So this way, coming from this circumflex, okay, be running on the margin. Let me put it this way. So this becomes, okay, in this case, we are going to call it not right marginal, but this time toward the left, so the left marginal artery. Left marginal artery. And remember, this time around, the left marginal artery, the angle that it makes with the main trunk, okay, it's actually an obtuse angle, and that is why we may also call it obtuse marginal artery. Obtuse marginal artery. Yes. So I want you to appreciate these things. Okay. Now there will be other ventricular branches and all that, but these are the major things which I want you to appreciate as far as the left coronary artery is concerned. I've told you that the trunk is so short, it arches over there, giving us the circumflex artery. Okay. Then it also gives us this important branch which I call it the anterior interventricular artery, or the left descending artery. Okay, and that one also gives off to the left side of it. It gives off the diagonal, the name is diagonal artery. Okay, and then also from the circumflex artery, we find what we call the left marginal, or what we call the obtuse marginal artery. I want you to really picture this one. Okay, if it's in your mind's eye, then you will be able to identify all these vessels, right? Now, one more thing which I want to say, and then we move on to that of the veins, is that, you know, sometimes it's so difficult, real-time section, a lot of vessels around, you don't know which one is the artery, which one is the vein. And most of the times, you know, veins they tend to be collapsed. Because their walls are not as thick compared to that of the artery, usually they tend to be collapsed. Usually there may be some kind of blood in there, so the color, okay, can also help you distinguish between the artery and that of course, the vein. But in real-time section, you should be able to identify these things. Usually the arteries will also have tortoise pores, okay, they will be a bit tortoise. So once you know that, you know you are looking at the artery, okay, having all those circular lumina. So let's move on, and then of course talk about the venous drainage to the wall of the heart, the venous drainage. Now for the venous drainage, yes, let's use still the same diagram. Okay, let's use the same diagram that we used. Okay, so that we bring out the distinction. Let's use this same diagram for it. Of course, you know that the left and then the right parts will be separated by a groove over here. Some people call incisura epis cordis. Okay, I mean the notch that we find over here separating them. Now, in the case of the venous drainage, the main venous drainage is something we call coronary sinus. Coronary sinus. So let me change this one to coronary sinus. The venous drainage is mainly through this coronary sinus. Now, taking that, and remember, they are opening vessels. Okay, where are the veins going to? They will be draining to what we call the right atrium of the heart. Now remember that last week I told you that the right atrium will have what we call the rough anterior portion and then the smooth posterior portion. Okay, I am interested in the smooth posterior. That's where the vessels will be opening. The smooth posterior portion, except some case I will tell you about that one, will be opening into the smooth posterior portion of the right atrium of the heart. So it means that it should be at the posterior portion. So the coronary sinus will not be anterior. You will not be seeing coronary sinus at the anterior portion. You'll be seeing it at the posterior aspect, okay, towards the right atrium of the heart. That's where you are going to see, in that atrioventricular groove. So let me use blue to show that one to you. So assuming this, okay, I'm using dotted line to show that it's at the posterior portion. This one I have over here is nothing, but I'm talking about the coronary sinus. Coronary sinus. That's what I'm talking about here. Now, this coronary sinus, one important thing which often it can be asked in your exam, the main tributary or distal continuation, or let me use proximal continuation, because at the end it will be beginning downwards, it will be going upwards, of this coronary sinus is what? It's actually something we call the great cardiac vein. Now, please watch this. The great cardiac vein will be running alongside where we have what we call the anterior interventricular artery. So whenever you are seeing the anterior interventricular artery, the corresponding vein which will be running with it will be the great cardiac vein. So for instance, this is toward the anterior aspect, so I'm going to have my great cardiac vein is coming across. It's coming, and then it actually goes this way. Okay, the left, oblique border. Okay, then it comes down, and then it comes in and drains in here. This is how it goes. Now we have what we call the great cardiac vein running in the anterior interventricular surface. So you can see I've not used any broken line. It's moving continuously across. Coming upwards, then it turns around. Because I told you, why should it turn around and go backwards? Because that's where it will go and meet the coronary sinus. The coronary sinus are the posterior aspect. When it goes anterior, it won't meet anyone. So it has to go backwards, okay, by running along the left oblique border of the heart. So this guy over here is nothing, but we are talking about the name is great cardiac vein. And my friends, why do you think we call it great cardiac vein? Because as I told you, usually some anatomists believe that it is the proximal, let me put it that way, continuation of this great cardiac vein which forms the coronary sinus. So it's the greater contribution to this coronary sinus we are talking about, the great cardiac vein. So one thing which is very examinable also for you is that which arteries accompany this great cardiac vein. I want you to tell me. We've done some of these arteries. So one of them is going to be who? The anterior interventricular artery, or the left anterior descending artery. We'll be running alongside with it. And what else? It will also be moving artery arched, okay, moved around the circumflex, okay, circumference of this heart. We call it what? Circumflex artery, a branch of the left coronary artery. So it means that getting to the proximal region, its terminal point, going to drain into what we call the coronary sinus. It will be moving with the circumflex artery. Good, that's one point. Now the other point, now what do you see? Another thing too that you see is that this is towards the right side. As I told you, always the right border of the heart is a vertical border. The left portion is an oblique border. That's what we usually see. Now, how is it draining? For you to also appreciate, sometimes people get confused. Is it the small cardiac vein, whichever? Now, the great cardiac vein will be opening, okay, into what we call the coronary sinus to the left portion or the left margin of the coronary sinus. Please get to know that. Then the question is, how about opening onto what we call the right margin of the coronary sinus? How about that one? And my friends, that one is just as simple as that. I told you that there was an artery which was running over here, okay, along the inferior border of the heart, okay, towards the right side. And I told you that's the what? The right marginal artery or the acute marginal artery. The same way, so the vein will be coming this way. Okay, this, okay, there's another vein running in this manner, coming all the way. But that one too got to come, okay, come out this way and then come towards this direction. It has to go backwards. For this reason, this artery we find over here is actually nothing. It's not a great cardiac vein. We call it the small cardiac vein. This is the small cardiac vein. Okay, small cardiac vein. Okay, small cardiac vein. So another question to you, which is also examinable, we want you to tell us that what arteries accompany the small cardiac vein. We've mentioned one already. That is the right marginal artery or the acute marginal artery. Not only that, what did I tell you? From what we call the anterior aortic sinus, okay, I mentioned that one to you. The artery which will be coming, that is nothing but of course the right coronary artery. The right coronary artery has to go backwards, running through the coronary, sulcus over there, and then also go this way. And that is why this, let me say the terminal portion, okay, going to drain into the right portion of the coronary sinus is nothing but it's going to be that of the the right coronary artery. So the two arteries which will accompany the the small cardiac vein will be, of course, the right marginal artery and the right coronary artery, the main trunk of the right coronary artery. Good. Now, are we done? No, we are not done. We have a lot of things to talk about. Now, these are not the only tributaries to the coronary sinus, but also we also have another vein. Now, this time around the vein, unlike the great cardiac vein, which is running in the anterior interventricular sulcus, this vein will be running in the posterior interventricular sulcus. So there should be another vein running in the posterior interventricular sulcus. So that vein, I'm going to use dotted lines to show running in the posterior interventricular sulcus. And my friends, what do you think will be the name? If you've seen great, we've seen of course the small. This one becomes the intermediate. We call it the middle. It's in the middle of the two. So we call it middle cardiac vein. So with this orientation, if you have a real-time heart with you, you should be able to tell us that yes, those are the posterior aspects. Okay, you've turned at the posterior, you see the vein running over there, going to dump itself in what we call the coronary sinus. That is the middle cardiac vein. Then the question is, what artery accompanies this middle cardiac vein? I'm sure you can tell me Now the artery which will be accompanying this middle cardiac vein is what? The posterior interventricular sulcus. Okay, so what do you think? We are talking about nothing but of course we're moving with what we call posterior interventricular artery. Okay, or the right, posterior descending artery. Okay, I want you to know that posterior interventricular artery. That will be running with it. So that one, in the case of middle cardiac vein, is a single vein that we talk about. A single artery will be accompanying it. Okay, because already it's running in the posterior aspect. It doesn't turn anyway. So it will be moving, okay, with a single artery. That is good. Now, are we done? No, we are not done. There are some veins. They also drain. Actually, mainly they are draining what we call the left ventricle of the heart. Now, the left ventricle is a very thick walled muscle. So it needs a lot of arterial supply. It also needs a lot of venous drainage. Okay, and so that is why you may also have additional veins. Okay, so for instance, there may be a vein. Let me call it. Okay, towards. Let me intentionally bring it like it's draining from the left ventricle. Okay, so this vein will be nothing but it will become. It's right in the posterior aspect. So we call it a posterior vein of left ventricle. Posterior vein of left ventricle. Now let me use a different thing to highlight this vein. Small cardiac vein, let me put you in brackets in this box. Now this one, which I've highlighted it in a different thing, it doesn't run with a special artery, no. So that's why I don't want to ask you which artery accompanies this one. No, it doesn't run with any major artery. So we just keep it that way. Now, one more thing which I want you to appreciate is that coming actually not from the right atrium, but actually from the left atrium, there's a vein which comes from the left atrium. Okay, so this vein, it actually runs in an oblique fashion. We call it oblique vein of left atrium. Oblique vein of left atrium. Now, this oblique vein of left atrium actually has an eponym. So sometimes simply we call the vein of Marshall. Okay, so I want you to appreciate that we have the left, okay, oblique vein. Okay, that one also goes in there. It's a tributary. Okay, remember always we're talking about tributary. Okay, it's also a vein which will be draining into the coronary sinus. So for now, if I ask you what are the major tributaries of the coronary sinus, then you don't forget the first one to talk about is the great cardiac vein. You mentioned the small cardiac vein, the middle cardiac vein. Okay, they will be moving along with some important arteries, coronary arteries, and then you go to that of the posterior vein of left ventricle. Okay, and then also the oblique vein of left atrium. That's a normal case. Now they are supposed to drain into the coronary sinus, and then from there, from the coronary sinus, it will be drained into the right atrium of the heart in the smooth posterior wall. But my friends, there is a catch. There are some veins, they don't drain into what we call the coronary sinus. They want to do their own thing. They want to drain directly into the right atrium of the heart. And interestingly, they don't also even drain into the smooth posterior wall. They drain into the rough anterior wall. Okay, so we call such veins. So sometimes there are some veins. They drain directly. Okay, they drain directly. So let me say this. They drain directly into what we call the rough anterior wall of what we call the right atrium. Now, such veins, we call them anterior cardiac veins. So sometimes if you look at the heart and you are looking at the wall, anterior wall of the right, atrium, you may see some veins going in there. And we are not talking about any other thing, we are talking about the anterior cardiac veins. So it means that anterior cardiac veins are not tributaries of the coronary sinus. I want you to appreciate that. So my friends, I believed you've been oriented, okay? When you talk about all these, veins, okay, all these arteries, by way of the coronary arteries, by way of tributaries of the coronary sinus. I believe you find this meeting helpful. Now next week, I'll bring you another thing. Yes, so in the region of the thorax, we explain some other important things, concept over there. And I'm sure you are going to make a date with me. Have a good night, all of you, and may the good Lord richly bless you. Amen.